the FDA, so the American regulator, sort of putting out a warning, if you like, for patients, but also, I guess, clinics to say that RF microneedling is potentially problematic.
Right.
Now, first of all, you'd probably know more than me. What is RF microneedling for the people who don't know out there?
Well, I mean, it's basically it's a radio frequency microneedling treatment. So you put a handpiece on the face, it delivers a radio frequency pulse of energy through little sort of needles that sort of go into the skin. You can obviously adjust the power and the depth and things like that.
Yeah.
And through that energy, it causes collagen stimulation. It can help with pore size. It basically does what a microneedling pen can do, but I guess supercharged.
Yeah,
essentially.
Because it's using energy as well as trauma.
Yeah.
Yeah. So, I mean, the FDA, I'll just read this out, identified a number of serious complications reported with certain RF microneedling devices, including burns, superficial to deep dermal, scarring, including hypertrophic, atrophic, subcutaneous fat loss or lipoatrophy, particularly in people who are thin-skinned or on bony parts of the face, nerve damage, including numbness and dysesthesia, so kind of pain, disfigurement from the combination of the above effects, and in some cases need for surgical repair or medical intervention. So, if you're a patient reading that, you're probably thinking, never going to go for that sort of treatment. But I think like with all of these things that are advertised or sort of spoken about on Instagram, there's some context and nuance to this. So the upshot was, listening to the American providers talking about this, is that it's not a device issue or not proven anyway. It's more of a user issue. Same as filler complications, same as toxin complications, same as surgical complications. Sometimes things happen and we consent about these in our consent process, or certainly should do. And just sometimes it's unfortunate. I don't know if we can always blame anyone. Sometimes just bad luck happens, but it's actually a user issue. It's a training issue, and potentially even sort of a black market device issue. If the wrong device is used, then of course, probably more susceptible to burns and other problems.
Yeah. I mean, the idea behind microneedling was that it potentially could be used by anyone. It was, you could treat darker skin types with it. So it wasn't really doing, treating the way a laser was, which was through a different chromophore in the skin, like it was attracted to melanin, for example, whereas the microneedling was something that you could pretty much do on most patients. So the fact they're getting scarring and burning on a device that's supposed to be safer is quite concerning. And as you said, I think it does show that there's a user issue.
Yeah. I mean, we've had a similar thing, maybe not an FDA warning, but a similar argument bubbling for years about HIFU.
Yeah.
And, high intense focused ultrasound, where you use it around, say, the jawline to create collagen stimulation, etc. And lots of people were sort of anecdotally saying, hey, I look thinner. Have you dissolved my fat with HIFU? And, same kind of things being reported with RF microneedling. And so people would say, well, hold on, that seems like a user issue, because if they didn't understand the area of the face or the thickness of the skin to start with, it's kind of logical that you've probably gone too deep.
Yeah, well, it's kind of been, as you said, like a rumor or a claim that these treatments can melt your fat. And a lot of people are saying, no, there's no evidence for that. It's not true. It's in your imagination. But the fact that the FDA have come out and said, no, it actually is a real thing. Yeah. I think that's quite significant, to be honest. Avoiding, sort of keeping that separate from the user error, the fact that they've come out like a regulatory authority has come out and said this actually melts fat. I think that's kind of significant.
And also, many of the devices, I won't use brand names, but they are marketed to dissolve fat or burn fat, whatever the mechanism is. Because, if you've got submental fullness and you want less of that, you can deliberately use these devices to try and achieve that if you don't want surgery. Yeah. So it's not bad or good. It's just the context.
Well, and knowing if you don't want to melt fat in an area, then are they an appropriate candidate? Have you got the right settings?
Right.
Yeah.
So
what did they say basically?
Really it boils down to, and this, again, I'll just read a list. This is for patients. Be aware of the risks. Yeah. Discuss the risks and benefits with your provider. Confirm that the provider is trained on the device. Ask which device will be used, how many passes, what's the needle depth, etc. Seek medical advice if you notice any unusual symptoms or complications, and avoid using RF microneedling at home or outside what appears to be a reputable clinic.